So my name is Kurt Brinkus. I'm the founder and CEO of Indigenous Pact, and I'm really pleased today to introduce Sean Heberling. He's a CFA and he's our Chief Financial Officer. In general, today he's going to be discussing the coronavirus progression across the globe and the related impacts as he's been tracking the financial markets. And really what we're going to be doing is discussing how we can explore different types of strategies and how these markets are impacting tribal finance and as well as the tribal economy, and the sorts of things that we can do for financial crisis management as tribes. So prior to joining Indigenous Pact, Sean spent over 20 years in finance working for firms like BNY Mellon and Morgan Stanley. He holds a CFA charter, as I've mentioned, and he teaches finance to undergrad students at Villanova University. So with that, I will hand it over to Mr. Sean.
Great, Kurt. Thank you very much. So I want to lead off with, Kurt, let me know, you can see my screen right now with these three sort of headlines on the screen?
Everything looks great.
Okay, perfect. So I want to lead off with by highlighting what I think we're probably, or most of us are probably experiencing in the current environment. So anytime we turn on the TV, anytime we open our email, anytime we pop over to the website of a newspaper, we're almost bombarded on an hourly, certainly on a daily basis, with headlines such as these on the screen right now, which is, COVID-19 is not containable, it's set to overwhelm hospitals. This came out of the European Center for Disease Prevention and Control, which was then picked up by both U.S. media outlets as well as the Center for Infectious Diseases in the U.S., and help sort of accelerate the implementation of this national social distancing paradigm we're currently experiencing. Alongside that, we had this projection for 2.2 million COVID-19 deaths expected in the U.S. That was propagated by the Imperial College of London's COVID-19 response team. We have since seen many of those predictions dial back to somewhere between the 100,000 and 200,000 person mark in the U.S., largely because of the social distancing that's been enacted in this country. And then finally, and this headline is perhaps something we all sort of perceive, though maybe we don't quite put as much tangible perspective on this at the moment, which is U.S. unemployment could surge to 30% next quarter and GDP might plunge 50%. This was a headline that appeared in a publication called Markets Insider. Similar headlines appeared in Bloomberg News, on CNBC. This was actually a little bit of a soundbite out of the St. Louis Federal Reserve President Jim Bullard's blog post, which was designed to try to quantify potential impacts in what might be considered a worst case scenario, in the hopes that we could design sort of a national approach to mitigating a worst case that might be this bad. You marry those headlines with something that every news outlet and certainly any financial media keeps in our faces on a minute-by-minute basis, and this is performance of various stock market indexes from around the world. And on this slide, I chose to show the S&P 500 in green, the Russell 2000 in purple, the Chinese stock index in gray, the Italian stock index in yellow, and the Korean stock index in red. And I'll get into a little bit about why I chose these particular indexes to show to you today and what I think we can learn from them. And again, it's a sort of reiteration of bombastic news headlines combined with this sort of semi-quarantine social distancing paradigm we're all currently experiencing that probably invokes some fear, some apprehension, certainly a lot of concern about both our health and financial wellness going forward. And what I really want to accomplish and take the time to do with the audience from this point forward in our presentation is, number one, try to shove that fear and apprehension aside and take a really objective look at global case data, at some of these global financial markets, and at the national plan of action that St. Louis Federal Reserve President Jim Bullard helped prescribe, with the goal being to help us figure out specifically what Indian country can learn from global case data, from these various stock markets, and from this Federal Reserve prescription itself. So let's start by looking at some of the case data that exists out there. And I'm actually going to preface a dive into 4 different geographical sets of case data with a more interactive look at an epidemiologic model. Because one of the things that's going on right now is the entire world is trying to figure out how long are we going to sit in this current situation. And the best way to try to answer that, or the most common way that stakeholders worldwide are trying to answer that question, is by playing with these models. After we've looked at the model, we can take a look at some case data itself, and then we can talk a little bit about localized data and what we, the audience, can do to try to get our arms around that. So let's start with this interactive model. And I'm going to have to adjust my screen sharing, so just bear with me while this comes up. I'm going to scroll down to where I can have this interactive model up for you before I switch over my screen sharing. Okay, perfect. So I'm going to stop sharing for a moment so I can reshare. The screen I just linked to. Okay, so can everybody see this giant chart that's on my screen now?
Looks great.
Okay, fantastic. So this chart was actually published by the New York Times. Their staff built it in conjunction with 3 different scientific professionals. And the purpose of this for their reader base was really to help them get a sense of, what kind of factors go into projecting just how bad things could get with respect to the COVID-19 virus and how long we might expect to endure the current social conditions that we're experiencing. So this model is set to look at the population of the United States, which currently is around 330 million people based on some estimates of where we currently sit. So as of the end of March 2020, the best guess for how many people are in this country is around $330 million, 330 million people. This model is set originally to an intervention of 14 days. We know that is no longer accurate because we've just introduced federal guidelines for an additional 30 days. So really, I'm going to set this to more like 45 days. And you can see what that's doing is, quote unquote, flattening the curve, right? And the reason you hear that term is without any social interaction, given the other current parameters of this model, it's saying more than 50 million Americans would be infected. Something around 15 million Americans would be hospitalized, and you're going to get, that's probably where you get your 2.2 million projected deaths in this country. Well, we're definitely intervening, and it looks right now as if we're on track for 45 days, which kind of shifts the shape of that curve. We'll address that in a moment. Intervention level is set to moderate, where an aggressive response includes drive-through testing, social distancing, and closed businesses and transportation. Almost everything shuts down. I sort of feel as if we are now beyond moderate, more towards aggressive, maybe not as aggressive as we could be, but probably something in this neighborhood where hopefully, instead of a double peaked wave, we're still looking at a single peak wave. Impact of warm weather. In theory, warm weather could perhaps reduce the spread of this virus. Admittedly, no one really seems to know a great deal about that. Intervention date, March 13th. That was the default here. That seems reasonable. Infectiousness, I'm actually, and I'll explain this a little bit more in a bit when we look at some of the various case data. I've set that a little bit north at 2.8 people. Basically what that means is for every sick person, that sick person may infect 2 to 3 other people, closer to 3. By way of reference, some other studies indicate that the average flu, each person affected by the flu impacts on average 1.5 other people. So this is certainly more infectious than the normal flu. 2 other factors we look at, share. This is the share of infected people. What share of those people will require hospitalization? Kurt, I think you've been seeing something in the neighborhood of 13%. Is that correct?
Yeah, the last estimates I saw were 13%.
Right, so we're going to increase that. And then the death rate of 1%. Look, some countries like Italy are obviously higher than that. There have been other countries that have been less than 1%. I'm going to leave it at 1% for now. Frankly, although death rate is obviously a serious concern, death rate does not necessarily increase that hospitalized level as materially as it increases the portion of those who are hospitalized that then die. And one of the reasons that there's so much focus on the share requiring hospitalization is because the main objective of this flattening the curve is to get this lighter red this medium red bulge down inside of our estimates of critical care capacity in this country. The sort of related theory being, look, if you overwhelm the healthcare system, then the probability of healthcare workers getting sick increases dramatically, and then you really can't help people that require hospitalization, and you'll get a much higher death rate. So that's an interactive look at some of the key inputs behind an epidemiologic model. You've got intervention level, impact of warm weather, intervention date, infectiousness, share requiring hospitalization, and death rate. Now, some other inputs in there that aren't explicitly called by the New York Times in this model, age. So share requiring hospitalization is obviously related to age. Death rate is obviously related to age. Time to recovery is theoretically an input in a model like this, although it's not explicitly labeled in this case. The faster we can recover, then the faster people may be able to recover from this disease. Hopefully, the shorter we'd be able to get out of this quarantine situation. And then also the asymptomatic infected period. So that would be the period before which you are diagnosed with COVID-19, during which you may have been interacting with other people. And prior to this social quarantine situation, that would have been a pretty material variable impacting the infectiousness level. Hopefully, since the social distancing paradigm's been implemented, we'll keep infectiousness below this 2.8 level. So let me switch my screen back, and we can transition into looking at some actual case data from around the world. Okay, so Kurt, you can see my slide again?
Yep, looks good.
Okay, great. So I chose 4 geographies for us to view. We're going to start with Italy. Sorry, we're going to start with China. We'll move on to Italy. We'll talk about USA. We're going to divide USA up into 2 segments: New York State, which is predominantly the New York City metro area, and then the rest of the country outside of New York State. And then finally, we'll take a look at South Korea, not necessarily because it's got the most robust data, but because it has earned the spot as the geography to which many professionals are paying attention, because arguably they figured out how to solve this crisis earlier than most other geographies. So let's start with China. So on the left-hand side of this screen, we have the number of new cases that were announced and still are being announced in China. And this data started back on January 21st. So it was later than when their first case was reported, but it seems to be the date at which the rest of the world started really paying attention to the situation there. And from January 21st forward, you got this rapid increase in the number of new cases per day, which brought this from sort of a concern related to prior analogous situations in China to more of a headline concern. These are the types of charts that most of the media is choosing to focus upon. But these types of charts may not be the most helpful in terms of trying to get a handle on when and how long we might have to stay, how long we might have to enforce these sort of social quarantine situations, and how severe the disease and the health impact could be going forward. So one of the things I've done is taken that exact same data and tried to simplify it in a manner by looking at the natural log of those same cases. So basically, this is a mathematical way of saying, hey, let's try to look at this in terms of the pace of growth in new cases and the pace of growth relative to that expectation in the prior segment, where each infected person may impact 2.8 other people. And the reason I've chosen that 2.8 number, so to speak, is that's a number that's occurred very frequently in other similar mathematical types of situations. For example, population growth or the compounding of interest. Without getting into a painful level of detail around the math, that natural log appears in those other analogous situations. So if we graph the same data on this logarithmic manner, as opposed to just a very straightforward arithmetic manner, we can get a little bit different way to look at this. And we can also play with some mathematical means of projecting future directions. So admittedly, you're not going to get a clear answer by looking at this, but I think it's interesting that the best case on the top right of the screen is clearly very different from the worst case. And for those people trying to apply the same sort of forecast methods to the raw data, the raw new case data on the left, they might reach a much more concerning type of conclusion. My best guess, looking at this data, is that the best case may actually be slightly more likely than the worst case. A couple other data points to factor into our perspective is, and I acknowledge all the arguments around the reliability of Chinese data. Those are completely valid concerns. But we're talking about a country that's demonstrated just over 82,000 cases out of a population of 1.4 billion people. So a pretty small percentage of infected, or at least confirmed, reported infectiousness in this country. Let's contrast that with, say, Italy, where Italy's had almost 98,000 cases as of end of day yesterday. They have a population of just over 60 million people. Translates into a 0.1% infection rate. Certainly much more significant than China, but in the grand scheme of things, not nearly as bad as, say, Spanish influenza of 1918 or a Black Plague sort of scenario. Concerning, yes, absolutely, but as concerning as the headlines may make it seem, maybe there's some room for debate there. So again, we look at the raw case data on the left. Clearly, we saw dramatic growth. And if we apply the same sort of logarithmic extrapolation to the graphs on the right, again, we get an unclear picture. In this case, I would echo my earlier comments with respect to China. From a mathematical probability standpoint, I would argue that the best case may be slightly more likely than the worst case, but we are clearly at sort of a critical juncture in terms of our ability to discern that more definitively. Let's move on to the USA. So first, we'll look at New York State, which is predominantly the New York City metro area. And here we seem to be earlier in the curve than certainly China and even Italy. And here, unfortunately, I would argue that the worst case may be slightly more likely than the best case at the moment. New York State has exhibited just shy of 60,000 cases out of a population of 19.4 million people. That's essentially triple the rate of infection of even Italy, which is concerning. And if the medical community, various governments can't get a handle on New York State in the very near term, that area may be at risk of significant expansion in both the number and, unfortunately, the rate of cases that they experience. So that's certainly something that everyone the world over is probably watching. We can contrast that with a look at the rest of the USA outside of New York State. And here, the chart on the left is clearly concerning. Although, I mean, you're still even earlier. Well, let me take that back, because we're challenged here in that the state of Washington really reported cases earlier than New York City. And now, after New York City has begun experiencing, the bulk of its problems, you're getting other geographies within the U.S. Factoring into this. So although time-wise you may be later from day zero, you could argue that you are perhaps earlier in the curve. And again, when we apply the same sort of mathematical, logarithmic means of forecasting to this, we can see very different potential outcomes, best case versus worst case. Keep in perspective when you look at these three charts that so far, the U.S. outside of New York State has reported around 83,000 cases. And we have a population outside of the New York City metro area of 311 million people. So clearly a very, very low rate of infectiousness currently. That said, the amount of testing is increasing dramatically. And you also, unfortunately, have the dynamic where people who live within New York State and who are afraid of the given situation may be leaving New York State and visiting other parts of the country. So there's probably reasonable justification for the argument that the worst case is more likely than the best case where we stand now. Now, before anyone gets terrified by that statement, I mean, based on the data we currently have, you're talking about a maximum of 70 days of data. Based on the data we currently have, we've got the ability to forecast 10 days out. That's not tremendously helpful. And if there's any solace we might take in this is, look, we've just sort of collectively agreed to extend the current social quarantine paradigm another 30 days. At the end of 30 days, we should know a lot more than we know now. Let's take a look at Korea next. So Korea is sort of hailed as the country that addressed the situation best. And you can see from the chart on the left, they were reporting new cases per day in the hundreds, not the thousands or tens of thousands, like some of the other graphs I just showed you. The unfortunate thing here is it does appear that South Korea is getting a little bit of a second wave, where obviously our best case projection here in the top right argues for a shallower wave, and our worst case projection may indicate that the country never fully addressed that first wave. So a second wave in South Korea may worry some folks and perhaps promulgate some more of those headlines that I showed to you at the beginning of the discussion. I would encourage everyone, as those headlines start to appear, to remain as calm and objective as possible, and certainly try to abide by some of the social practices that have been enacted. So we've taken a look at the model. We've taken a look at some data. I want to talk to you a little bit about what we could be doing at the local level. We can see that there's a big gap, and we have a limited ability to forecast even 10 days out. So there's a tremendous level of dependence upon case data. And everybody the world over is looking at pretty much the same data. Some local geographies may have done a better job than others of collecting data, but that's really what I want to encourage those of you who are involved with Indian country healthcare systems or tribal governments. To the extent you can encourage a really diligent collection of local data, and we're talking about statistics like how many tests have you administered each day? How many new cases, how many new positive diagnoses have you recorded? To the extent there are deaths, obviously you want to record those, but then you also want to try to differentiate between patients who died who had pre-existing conditions and those who did not appear to have any pre-existing conditions. You want to track data around age. You want to track data around how many people became infected but then recovered from this virus. How much time did it take them to recovery? How much time do those patients think, or how much time can you estimate those patients who did test positive for COVID-19 might have been asymptomatic prior to diagnosis? Because this sort of data will really help your local stakeholders create a plan more specific to your geography that may be more helpful in terms of forecasting and more helpful in terms of enforcing some of these social situations we're encouraging. So that's really what I was hoping to share with respect to case data, and what I'm hoping that Indian country might be able to learn from the case data. Kurt, are there any questions I can address here before we maybe shift our focus to some of the financial markets and what the St. Louis Federal Reserve has said?
I don't have any questions, but certainly open to anything from the group. One thing I would mention, Sean, is we recently just got our hands on, I think just yesterday, we became aware of how Indian Health Services is doing their best to track some of this data. So what they've done is, looks like they're breaking it down by IHS region. tested positive and negative. So we might be able to have you put together these same graphs for these regions. And we can take the estimates of the population and things like that and see if we can develop the curves and publish those to the group here.
Absolutely. Okay. So if there are no questions yet, I'm always happy to address those at the end. We can move on to looking at trying to ascertain what Indian country can learn from some of these financial markets, as well as the national pandemic adjustment period plan that was prescribed by, we've got a picture on the right here of St. Louis Federal Reserve President Jim Bullard. So these markets on the left, I mentioned earlier, I chose a variety of stock market indices. And what I was thinking here was really trying to put myself in the shoes of someone involved with economic planning for any particular tribal nation. And, what's good for, say, the U.S. maybe isn't the best possible approach for a particular tribal nation. And from a financial standpoint, I've sort of viewed the typical, if there is, a typical profile for the economy of a tribal nation, I sort of view that as maybe most like one particular stock market index called the Russell 2000. So I'll explain what that is. So any given index contains a certain number of companies within it. And these are all companies who have stocks that trade in what we call the public markets. So the Russell 2000 has 2,000 stocks in it. There are a little over 3,700 stocks that trade in the U.S. markets. The Russell 2000 is a sub-segment of a larger index called the Russell 3000. The Russell 3000 comprises the largest 3,000 public companies in the U.S. So it's 3,000 of 3,700. It's almost everything. It's basically the smallest, least viable companies that are excluded. The Russell 2000 includes just the smallest 2,000 of the largest 3,000 in that Russell 3000 index. So it's basically, the idea behind this index is, look, these are the 2,000 smallest yet most viable companies in the U.S. And I feel as if that may more accurately describe, of any stock market index available, that may more accurately describe what I might consider to be a typical tribal nation economy. So if I compare the behavior of that index relative to this January 21st day, the day the Chinese problem with COVID-19 really seemed to become apparent, the Russell 2000 has performed very similar to the S&P 500. So the S&P 500 was down 22% as of end of day yesterday. Russell 2000 is down about 23%. Interestingly, the Korean stock market is also down 23%. And the global Morgan Stanley World Index is down 24%. So in theory, what the typical tribal nation may be experiencing is not that much different than what most of the rest of the world is experiencing, with some noticeable outliers. So, for example, Italy, much worse. I'd say materially worse outcome, which makes some sort of sense considering how bad the pandemic's been there. And also much worse than what China has experienced. So the experience in these middle of the road indices are better than Italy, but far worse than China, which is interesting. China had the least, one of the lowest rates of infection, if you believe their numbers. They were fairly aggressive in terms of addressing it. Hopefully they don't get a second flare-up. And we don't know at the end of the day where these indexes may wind up. So that's the rationale behind why I share these particular graphs with you. In terms of addressing the financial impact of the health crisis, I think it's interesting that President Bullard put together this National Pandemic Adjustment Period Plan, which has three kind of main points. One is greatly reducing economic activity, arguably to mitigate the health aspect of this. Number two is keeping households and firms whole, and I think that could be interpreted two ways. Number one, certainly from an economic perspective, obviously with jobs being lost associated with businesses closing, to the extent we can try to help households maintain their current income, honor their current financial obligations, that argues for a better outcome once the situation subsides. And the second way we can interpret that second point, keeping households and firms whole, is from a health standpoint, right? I mean, losing a portion of our population is not good for our economy. It's not good, period. So obviously we want to mitigate that. And the final point of this National Pandemic Adjustment Period Plan is actually paying for the pandemic response. And there's a couple components to that response, which I'm sort of getting at on this next slide. There's the health response and there's the financial response. So let's delve into each of these a little bit here. So from a health response standpoint, we're talking about first and foremost social distancing. And why are we talking about that? Because it seems to demonstrate the highest probability of restricting the growth of this infection. And that resonates with studies of other pandemics like the 1918 Spanish influenza. So that's kind of step number one. Step number two is, even within healthcare, there's an argument that activity should be divided into what's essential and what's non-essential. And once that's done, we want to focus our resources on the essential activities. And there are plenty of arguments for why we really need to expand specific capacity regarding some of those essential activities. For example, critical care facilities, right? And while we're doing that, we're going to have to figure out what to do with some of the people who were earning their income from what have now been deemed non-essential activities. And so there we're really talking about repurposing labor. So that's a little bit of a roadmap in terms of the elements we need to consider with respect to health crisis management. There are some real parallels with the roadmap for thinking about how we handle the financial side of this crisis management. So the tools and approaches we might consider here are probably going to differ fairly widely depending on whether you are a tribal government, whether you are a tribal or non-tribal healthcare system, whether you are a tribal or non-tribal private enterprise. And I probably could have even included, tribal or non-tribal households in here. There's a lot to think about here, but there are definitely ways to achieve each of those three kind of critical components of that national pandemic adjustment period plan, which we could certainly discuss and debate and weigh the pros and cons of each. But I think the overall conclusion here, based on case data, based on the reaction of certain financial markets, and based on plans being put forth, like St. Louis Federal Reserve, is that we have a lot of good arguments around planning for the worst, hoping for the best, but staying calm as we experience these inevitable ebbs and flows of good news, bad news. To the extent we can track our data and make that data as accurate, as detailed as possible, that should really lend itself to forecasting and reacting in real time to some of these developments. Enforcing social distancing, and I intentionally left that word encourage struck there because I recently listened to an interview with the author of a book studying the 1918 Spanish influenza. In that book, he referenced a study done by somebody else who studied 120 different military camps in this country that had been established during the influenza. And of those 120 camps, only a very, very small minority of those camps demonstrated limited infectiousness. And although it's something like 80 of the 120 camps had encouraged social distancing, only a small minority of those camps actually enforced it. So given all the evidence supporting the ability of social distancing to really limit the spread of this, if you're a tribal nation and your hope is to get out of the situation as quickly as possible, the evidence strongly argues for enforcing rather than simply encouraging social distancing. And then we get into some of the nuts and bolts behind what you do with your economy and your healthcare system once you've enforced that social distancing. So separating both healthcare facilities as well as private enterprises into essential versus non-essential activities, expanding your healthcare capacity, repurposing your labor, and then finally, the one item to which maybe I alluded but didn't explicitly address is enacting household shock absorbers. So the U.S. government is currently trying to do this with this CARES Act and mailing households, $1,200 per person with $500 per child additional credits. To the extent Indian country might be able to think about doing something like this, perhaps in addition or in conjunction to traditional state unemployment, there are some very real, legitimate reasons to consider doing this and to think about ways this could be practically and legally enacted. So I'm going to conclude there, and I'm happy to address any questions folks might have here.
Sean, I want to ask you about expanding healthcare capacity. We've talked to a handful of different places where we see that they have reduced capacity around their healthcare operations. And I think part of it is out of safety concerns, maybe not knowing exactly kind of different tactics they can take. But what are the, I guess, can compare and contrast, expanding versus contracting healthcare operations right now for tribal economies?
So, acknowledging that every situation is going to have kind of its own specifics, I'll try to stay within the guardrails of how my thinking might more generally apply. And perhaps in order to do that, I'll frame it with respect to what Jim Bullard of the St. Louis Fed laid out in his recent detailed blog post. So the way Jim thinks about this is, look, your GDP before this happened was, say for a tribal economy, it's $1 billion, right? If roughly half of that GDP is essential and half of it is non-essential, and you make the decision to really restrict the non-essential activity, you've basically cut your GDP in half very quickly, right? Well, what's left in that 500 million of GDP will be a fairly substantial share of it will be healthcare, right? Because many of those activities will be deemed essential. And to the extent that you can put resources into that, quote unquote, invest into your essential healthcare activities, ideally you would get some growth in GDP as a result of that and essentially help mitigate the economic impact of this crisis. And also, in addition to mitigating the economic impact, you should arguably be able to favorably mitigate the health impact of this crisis. The rationale for quote unquote flattening the curve is, look, we get the number of hospitalizations required as a result of COVID-19 at the peak below what we estimate our peak flexible critical care capacity to be. So if we can increase our critical care capacity by investing in flexible facilities for healthcare, you accomplish 2 or 3 goals at the same time. So I guess that's a very general way of addressing your question. I'm happy to address any follow-up, more detailed questions you might have.
I want to ask another question about the households that you brought up. We've seen different tribal communities take slightly different approaches. We see some communities that are sending their people home for both essential and non-essential activities and fully paying salaries for those people to be at home. I can contrast that, and we've seen some of that out west. I can contrast that with some of the things that we're seeing with tribal communities here in the Midwest, where they've essentially laid off or furloughed both essential and non-essential activities, and now what they're doing is pushing them all into unemployment. And I guess can you give some insight into those different tactics and how that might impact these economies as well?
Yes, so that's a really interesting angle. And what let's call something like unemployment a social or household economic shock absorber, right? It's designed to, look, rather than creating a cascading set of falling dominoes by eliminating income entirely for a large swath of households, which is, it's just going to ripple through the economy. There would be very few parts of the economy not impacted by that. Instead of doing that, let's preserve some minimal level of household income, at least so they can cover food, shelter, and utilities, while the nation makes its way through a painful economic period. Now, the traditional state unemployment program winds up providing roughly 45% of the median household income, which is probably not enough to avoid a really serious overall economic impact. That said, these shock absorbers probably don't need to provide 100% of household take-home income, because we know the household should be saving a portion of that, and you don't necessarily need to replace saving in a time of economic crisis. And then households also spend a reasonable percentage of their income on non-discretionary items, which you may not want to finance. As a government, you may not want to finance during a sharp economic contraction. So there's legitimate argument for having a shock absorber, and there's probably also a legitimate argument for having the ability to supplement the shock absorbers that are currently in place to minimize the overall economic impact. So, some of the tribes who might be not availing themselves of state unemployment and providing households with 100% of replacement income are obviously going to incur really significant financial liabilities. There's only so much runway any given tribal nation is probably going to have to do that, right? I'm sympathetic to the idea that, look, these state unemployment programs exist. As employers, and anyone out there who might be involved with a tribal employer, these employers pay into those state unemployment programs. So really, there should be less of a stigma associated with encouraging or allowing your labor to make use of that. So I really do feel as if there's a lot of rational argument behind having tribal employees collect state unemployment during this painful period. Now, that said, there are rules associated with those state unemployment programs, right? Where you can't necessarily be collecting supplemental paychecks and expect the state to continue paying those unemployment benefits. But there may be some room for consideration for something like a loan to individuals who are currently collecting unemployment, where that unemployment benefit represents less than a certain percentage of their prior income, and their prior income did not exceed, some sort of socially acceptable level. And maybe there's a way to toggle the forgivability of those loans at some point in the future. So my inclination is that there's some room for some creativity, but it's going to involve, maybe a more detailed look at some of these state-by-state unemployment programs.
That's great. Thanks, Sean. So we're at time, and we want to be respectful that everyone has things to get back to in their communities. I'd like to remind everyone that we will be posting this recording, and you can share it with other people. We have a live chat on our website, so if you have any questions about COVID-19 or you have any additional follow-up questions from here, feel free to email us or use the live chat on our website. And I want to thank Sean for taking the time to put this presentation together today, and thank all of you for joining us today. Hope you have a great one and stay safe.